Because we have a real practice dedicated to rhinoplasty, because we work together over the last many years, have really created a real area of expertise within rhinoplasty. I think patients understand that when they've been through this process, they've had an unsatisfactory result for many different reasons, they really need to see a rhinoplasty or revision rhinoplasty expert. And we can't emphasize that enough.
Yeah, revision rhinoplasty is its own sort of baby. Rhinoplasty by itself is very difficult. What we tell patients is generally revision rhinoplasty can be one of two things or a combination. And what I mean by that is some patients present because there's technically something done wrong. This previous surgeon either was too aggressive in taking things out or putting things in and causing some real scar tissue. Occasionally it's just really purely an aesthetic problem where the patient thought they were getting X when they really wanted Y, and it's really important in those cases to sit there together and make sure that going forward we truly understand what the aesthetic goal is, and this time make sure that they get that resolved.
And there's a lot of emotion around revision. Patients have been in a situation before where they maybe have some regret or some doubt about going through this process again, and I think it holds a really special place in our heart to make sure that as we go through this process with them, we're doing everything we possibly can to make sure this is the last rhinoplasty they have to have. So we spend a lot of time really going through all the details from aesthetic, making sure the goals are very clear in terms of what we can accomplish, and then also making sure during surgery that we take every necessary step to have things healed just right.
Yeah, I think it brings a lot of solace to patients, some comfort to them, knowing that both of us are there during those procedures. I think that's really where the idea of us working together primarily started in the first part of the practice. Was in some of those more difficult revisions. I always sort of joke and say that, sometimes when you get into a revision case, what looked like it wasn't going to be a major problem, you open up the nose and you see it almost looks like a grenade went off in the nose, and you really have to have every asset, every possibility, every tool within the toolbox available to you to accomplish the goal that you promised to those patients. And having each other there, working through all the different procedures that are possible, and then really having this sort of belt and suspenders sort of approach to a revision rhinoplasty. I always try to uniquely tell each patient, listen, we're going to talk to you about all the possibilities. We may need septal cartilage, we may need ear cartilage, we may use irradiated rib cartilage or your own rib cartilage. Sometimes we need things like alloderm versus fascia, and all of these other conversations that need to happen. It's not because we don't know what we're doing, but instead because we do, because we understand all the nuances and variations and all the things that are possible when we get in there.
Yeah, I think the key to really being successful routinely in revision cases is that flexibility, that understanding that you really do have to understand what you're seeing during surgery and then be flexible and adapt to how you're going to fix that, what kind of solution you're going to come up with. And I think by working together, it really allows that flexibility. It's I think one of the worst things you can do at revision is be dogmatic. You'll hear surgeons say, I never use ear cartilage, or I only use this, or I only do that. I think for us, one of the real benefits of us working together is we keep each other's minds open. We're constantly discussing new trials, new results from journal articles we've read, what we think makes sense and what doesn't, and really challenging each other to make sure that we're keeping up with state-of-the-art techniques and adapting our practice and evolving from the results we've had to make sure that we're constantly doing the best possible work.
And it's important to understand that with revision, you can be one of those surgeons who does too much. You put too many grafts because you think that that has to happen. I think one of the really wonderful things about our practice is being double boarded, both ENT and facial plastics. We really do understand the functional components that need to be in place and how to structure that without making the nose look overly structured, without making it look too built up, so that that natural aesthetic is restored, but the functionality is all there for those patients.